Hello everyone, in this video we are going to discuss about acclimatization to high altitude physiology. So when a person reaches high altitude, in the sense that is more than 2500 meters or more than 8000 feet of height, the person experiences hypoxia. This is because there will be decrease in the atmospheric oxygen pressure and there will be decrease in the inspired oxygen pressure, that is decrease in PiO2. This hypoxia will stimulate peripheral chemoreceptors and this will cause increase in the ventilation or hyperventilation. So because of this increase in the ventilation or hyperventilation, there will be increase in the respiratory rate, but this causes increase in the carbon dioxide loss, because there will be increase in the oxygen intake and also increase in the carbon dioxide loss during expiration. So this increase in the carbon dioxide loss will cause respiratory alkalosis. So this causes increase in the pH levels. To maintain the pH levels and to decrease the pH levels, the kidney will lose the bicarbonate levels. So this respiratory alkalosis is compensated by the bicarbonate loss by the kidneys, and it maintains the pH levels. So this hypoxia causing the peripheral chemoreceptors activation is the immediate effect which occurs between hours to days. So whenever this hypoxia is chronic, what happens is in case of long term hypoxia, that is between days to weeks, there will be increase in the erythropoiesis, because of the hypoxia there will be erythropoietin secretion increases in the kidneys, causing increase in the RBC production, increase in the hemoglobin levels and increase in the hematocrit. So this increase in the hemoglobin levels will increase the oxygen carrying capacity, and there will also be increase in the 2,3-bisphosphoglycerate. This 2,3-bisphosphoglycerate will facilitate the unloading of oxygen at the tissue level, and this also shifts the oxygen hemoglobin curve to the right. And there will be increase in the capillary density. This is because to increase the oxygen diffusion. And there will be increase in the mitochondrial efficiency. In order to work even at the low oxygen levels, there should be increase in the mitochondrial efficiency. So immediately what happens in hypoxia is there will be peripheral chemoreceptor activation causing hyperventilation. This causes respiratory alkalosis, which is compensated by the bicarbonate loss by the kidneys, which equalizes the pH. And in long term cases of hypoxia, erythropoiesis will be increase in the 2,3-bisphosphoglycerate, along with increase in the capillary density and increase in the mitochondrial efficiency. So whenever this hypoxia is there, so person will experience three conditions, that is acute mountain sickness and also two conditions called as HAPE and HAZE. HAPE is high altitude pulmonary edema, HAZE is high altitude cerebral edema. So HAPE will occur with or without acute mountain sickness, but HAZE is mostly a part of acute mountain sickness, that is severe acute mountain sickness. What happens in hypoxia is there will be pulmonary vasoconstriction causing this high altitude pulmonary edema. In brain, what it causes is there will be increase in the cerebral vasodilatation causing high altitude cerebral edema, and there will also be increase in the reactive oxygen species. So we can remember the hypoxia and the consequences of hypoxia by the mnemonic of heavy camp. H stands for hyperventilation, E stands for increase in the erythropoietin levels as a long-term thing in case of chronic hypoxia. A stands for alkalosis, that is respiratory alkalosis, which is promoted by the activation of the peripheral chemoreceptors, that is increase in the ventilation. Yield of 2,3-BPG, which causes unloading of oxygen at the tissue level, increase in the capillary density, alkaline excretion by the kidneys, that is bicarbonate loss, mitochondrial efficiency increases, and pulmonary vasoconstriction.